Pamela, tell me where we are right now here at Community Medical Center.
So we're on the med-surg floor at Community Medical Center, and the timing's perfect because we are presently doing an education for staff on contact precautions. And this is the type of isolation, if we had a patient with Ebola, that they would be in this type of setup. So this is contact precautions. We have signage for each of the type of isolation precautions, one for airborne, one for droplet. But so for Ebola patient, we're using contact. So the sign with pictures tells you what you need to do. The back side of the sign had more information.
So how about the room itself? Oh, this is the cart.
Yeah, this
right?
is our isolation cart. And for instance, you have, if you need mask, goggles, we have gowns. Second drawer is your information drawer, so you have other signage. Information sheets for families we have in here. Then more mask, more information, and then extra gowns. So that's pretty much what the cart does. It just allows staff to have the equipment that they need. Mm-hmm. So as we go into the room now, keep in mind this is a skills station here. So we're trying to educate on proper precautions. So for instance, this one talks about transportation of patients. Sometimes your patient that's in contact isolation needs to go down to X-ray or other places, and so we have information on exactly what that would look like. For instance, the patient has to be in a clean gown once they exit and are into the hall area. So information on that. We have equipment. Equipment must be cleaned between patient uses, especially when a patient is in isolation precautions. We have dedicated stethoscopes. So for the patient in isolation, this is not shared. They have their own. We have policies regarding the cleaning of the room, cleaning of equipment, actual precaution policies. And
could you tell me about the negative pressure room?
So this is not one of the negative pressure rooms. We have 10 of those, and what those do, I describe it like a bathroom fan, actually. And so what happens is, with the flip of a switch, for instance, this is a positive pressure room, so the air is flowing out, but in negative pressure, it's sucking in. So when you have an organism like tuberculosis and you don't want the organisms out into the hall to expose other people, so you have the airflow going the other way. It goes through filters and then it's exhausted outside.